Good afternoon, everyone. My name is Cynthia Laughlin. I'm going to be discussing the innovation that I began in NSG596 and have continued in NSG597. A little bit of background information is nursing is my second career. I've been a pediatric nurse for 6 years now. I started off in pediatrics, fell in love with it, and decided to stay. I'm also a certified pediatric nurse as well as I hold my BSN through Purdue University. I work at a level 1 trauma center on the East Coast. To tell you a little bit about my preceptorship, I am doing more educational learning in the hospital setting. So my education is in an emergency department, and my population is pediatric patients with sickle cell disease who present with a fever. I have about probably 50 learners, mainly because I am doing 3 different groups of learners. I am doing registrars, healthcare technicians, and registered nurses. And I'll get into a little bit more of that a little bit later of why I'm doing it that way. The reason why I decided to do this innovation is because our pediatric population with sickle cell disease is pretty small. So sometimes these patients might not get noticed right away when they come in the emergency room unless their parents say, hey, my child has sickle cell disease. When pulling data, I had data from April of 2019 to February of 2020. We had about 115 sickle cell disease patients, pediatrics, who presented to the emergency department with fever. Of those, about 36 of them received antibiotics within the 60 minutes. Now, somebody might say, why 60 minutes? 60 minutes of receiving antibiotics on presentation to the hospital is a guideline set by the American Academy of Pediatrics as well as the National Institute of Health. So we have about 71% of our sickle cell disease population that presents with a fever that are not getting their antibiotics on time. My goal of this innovation is to hopefully increase this so that 75% of our sickle cell population, when presenting with a fever, will start receiving those antibiotics within the 60 minutes. Somebody asked me, why not 100%? I think when setting goals, I think they need to be realistic. As much as I would love to set a goal of 100% and make sure all these kids get their antibiotics within the time frame, I think we also have to look at situations and scenarios where these kids, something might happen for this to not happen. For instance, maybe the kid didn't get IV access in time and there was a reason for that. Or for instance, yesterday I was working and we had a tornado, so that could delay care. So I just think when we're setting goals, you just got to be realistic. And I feel like we're starting behind the 8 ball on this with having such a low percentage of kids that are receiving the antibiotics in a set amount of time, that if we can increase our goal to 75%, then once we achieve that, then we can set a new goal and maybe go to 85 to 90%. A little bit about my project. I'm going to be using behaviorism and constructivism as my project. And I feel like with so many people that are learners in this project that we have to try to touch on everybody's learning capabilities and how they like to learn. For instance, some people may read things, some people may prefer hands-on. So I want to make sure that every learner is interested in the learning and they want to learn about it. So, and with behaviorism, education helps elicit the response that you want. So I feel like if people can identify a little bit more of the patient population, then that will help our goal as well. And with constructivism, you can create meaning from your learning. So that's it. Once again, if people can have a different type of learning, then they might be able to bring more meaning out of it. My project started off with a pre-assessment. And as I said earlier, I'm doing our registration personnel that when the patient comes into the ED, they are being registered. And then I'm doing the healthcare technicians who triage, or they don't triage our patients. They are the ones that do the vital signs and place them in a room. And then our registered nurses who do the triage as well as care for the child. And the reason I did this is because early identification of these patients is very important. So when a patient walks into the ED, being able to say, for the parents to say, oh, my child does have sickle cell disease. And then that allows the registration to put in their chief complaint area, sickle cell disease -fever. That way that notifies the nurse that, hey, this is an immunocompromised child that needs to be taken care of right away and that there are time constraints. The healthcare techs also need to be aware that this is an immunocompromised child, which needs to be taken back to a room as quickly as we can possibly get them there. So by chance, if we're full and there isn't a room, looking at avenues to get them back to a room or get their care started quickly. And then obviously the registered nurses are the person who triages the patient and takes care of the patient, puts the IV in, administers the antibiotics. They can put in a standing order if the child has a fever greater of 101 for 12 hours, and that allows them to put in an IV and give antibiotics without even discussing it with the doctor. And so the reason I feel it's important to educate all three of these groups is because all three of these groups have to work together for the care of these children. That way they do get their antibiotics within that 60 minutes. We started off with a pre-assessment. And on the pre-assessment, there was a question on there about what is sickle cell disease? And somebody had asked, is that a necessary question? And I thought about it after right as I was sending it out. And I'm really glad that I left that question on there because the amount of healthcare technicians and registration personnel that did not know what sickle cell disease was pretty high. And then we even had a couple registered nurses that didn't know. We have several new nurses in our department. So if they've only read about it in school, they may not know what it is. So I do feel like that was a very good question to ask. I'm going to do virtual learning, and I've set up a couple classes, and then I'm going to also allow those that aren't able to dial in at those times to do it online as well. So it'll be a recorded education as well. It is going to be a required education so that every healthcare technician and nurse in our department will be required to do the learning. The learning will include a pre and post assessment. It will include a PowerPoint with lecture and a game with Jeopardy. I feel like having the lecture and the information out there of kind of the who, what, when, why, and where allows everybody to understand what sickle cell disease is, who might have it, and the fact that these kids are considered immunocompromised, and many people don't realize that. The post-test will then be taken. The pre- and post-test are the same thing. That way we can guide our information, some of our statistics off of how well the learning was. And then after all the learning is done, which I'm hoping to have it completed by the end of week 4, we'll go back, we'll run numbers again and pull the data from our sickle cell disease patients with the fever to see if it has increased any. That's my project, and I look forward to hearing more about everybody else's projects, and I hope everybody has a great day. Thank you.